Hi, Katie from Austin. How do you choose the right therapist? This is a question I get many times. And, the answer is actually pretty simple. First and foremost, know what questions to ask and trust your gut. I mean, that's the bottom line. You are going to be the best judge of who the right therapist is for you. You get a very specific question about MD versus PhD. I'm a clinical psychologist. That means from the moment I started my doctoral training, my master's training in psychology, I was trained in psychotherapy with individuals, families, children. Doctors, and I considered becoming a medical doctor, during their first 4 years of training, actually 5 years, study medicine. So when they get into their sixth year is when they begin the study and the clinical practice of psychotherapy. So that doesn't mean that they're necessarily not as well equipped, but if somebody's early in their career as a psychiatrist, as an MD, they tend to have less, several years less at least, experience as a psychotherapist than a PhD who is early in their career. But as time goes by, those differences evaporate. I've worked with many outstanding psychiatrists, so I'm not a psychologist who's going to tell you psychologists are better, and I've worked with outstanding psychologists. And then there's always some who aren't so great. So how do you decide? What kind of problem you have is going to make a big impact on your decision. If you're suffering from a very severe depression and you need relief quickly because it's impairing your ability to function, I would recommend a psychiatrist because medication, antidepressant medication, can be very quickly effective. That said, all sorts of psychotherapies, several psychotherapies, are very effective over a longer period of time, but not that much longer, just a few months, at treating depression. But again, it really is a question of the type of disorder. If you have a disorder like schizophrenia, a psychotic disorder, or bipolar disorder, manic depression, definitely go see a psychiatrist. As far as psychotherapy, again, both professions are trained in that field, but clinical psychologists do tend to have, and clinical social workers as well, earlier in their careers, they've got a more of a foundation. Now, the question of medication, depending on where you're living, also psychologists do prescribe more and more. I know it's in the state of New Mexico, psychologists can prescribe. And I think the differences between our two professions are starting to really change. I'm going to move to another question that we didn't post, and this is a question actually from Kathy from Chicago, Illinois. She asked a few questions, and one of them was about, if you have some difficulties with trust and you're worried about you want to get into therapy and you think therapy intellectually is a good idea, but in your heart you're feeling a little bit distrusting, like how can I trust this therapist? And frankly, if you look at the movies, if you look at how my field is portrayed in the movies, we eat our patients. Hannibal Lecter, we don't have the best PR when it comes to the media. Look, we're also in a position where people make themselves very vulnerable to us, which takes a lot of courage and it takes trust. So the bottom line answer to Kathy's question from Chicago is it's like that old, I think it's a Supreme song, my mama told me you better shop around. Don't be afraid if after 2-3 sessions with somebody you're not clicking, you don't feel the person's answering your questions, you don't feel you can be honest with the person, with the therapist, don't be afraid to shop around. It's hard, but the stakes are really high. And if you want to get better, if you want to improve your life, if you're looking at things like relationship patterns that you want to change and you don't want to make the same mistakes, isn't it worth the investment? Wouldn't you do that for your career? Wouldn't you do that for your child if you're raising a child? Shop around. If you go to one movie and it's a lousy movie, do you stop going to movies for the rest of your life? No. So there's a lot of wonderful therapists out there, psychiatrists, psychologists, social workers, other kinds of therapists. Check with the licensing board in your state. Make sure the person is licensed and there's no ethical complaints. That's a wonderful thing about the internet. You can do that. And trust your gut. Rule of thumb, if you don't feel like you're being honest, if you feel that the person is judging you, if the person won't answer questions about competency areas, so for example, do you have experience with helping a couple deal with infidelity, if that's your issue? Do you have experience with anorexia, if that's your issue? Do you have experience with depression, with post-traumatic stress disorder, etc.? And your therapist gets, your new therapist gets defensive, I would get out of there. Our job is not to get defensive or to judge. Our job is to listen and to help you find ways to change yourself so that you're living a more fulfilling life. And if you've come to us with specific problems, our job is to help you with the information and experience we have to find new tools to overcome those problems. So I hope this was helpful. And remember, again, you can't change other people, including therapists. But you can change what you do, and you can change yourself.